What if I told you that your mind is capable of relieving pain or maybe lifting your mood and improving your health all without a single active ingredient? It's a real documented phenomenon known as the placebo effect. What's up, everyone? You're watching Let's Learn Psychology. Today, we're unlocking the secrets of the placebo effect, your mind's own pharmacy. The story of the placebo effect begins in the late 18th century. The term placebo is derived from the Latin meaning, I will please, referred to a treatment meant more to satisfy a patient than to cure them. One of the first to demonstrate its power was physician John Haygarth in 1799. He investigated the efficacy of medical instruments called Perkins tractors. These were metal pointers which were supposedly able to draw out disease. They were sold at the extremely high price of 5 guineas. Haygarth showed that cheap, dummy wooden pointers worked just as well as expensive metal ones. This was the first real demonstration of the placebo effect. Another example is of the famous knee surgery trial. Surgeon Bruce Moseley conducted a study with 180 patients who suffered from debilitating knee pain due to osteoarthritis. The patients were split into 3 groups. Group 1 received a full arthroscopic knee surgery to clean out damaged cartilage. Group 2 underwent a partial arthroscopy. Group 3 received a sham surgery. In the sham surgery, patients were taken into the operating room, sedated, and given 3 small incisions in their knee to give the appearance of a real procedure. The surgical team would then talk and behave as if they were performing the actual surgery, even splashing salt water around to make it sound like they were irrigating the joint. The results were astonishing. At the end of the 2-year study, all 3 groups, including the sham surgery group, reported the same level of pain relief and improved knee function. Some patients in the sham surgery group even reported less pain than those who received the real procedure. So what exactly is the placebo effect? In its simplest form, it's a beneficial health outcome resulting from an inert or dummy treatment, like a sugar pill or a saline injection. The person believes they are receiving a real medical treatment, and their body responds as if they are. But this isn't just about positive thinking. It's more about the mind-body connection driven by powerful psychological mechanisms. From a psychological perspective, 2 main principles apply: expectation and conditioning. First, expectation. If you expect a pill to relieve your headache, your brain can actually start to make that happen. Your belief in a treatment's power is a huge factor. This is amplified by the context. For example, a doctor in a white coat who seems confident in the treatment can enhance the effect. Studies have shown that details of the placebo matter. For example, color. Blue pills are often associated with a sedative effect, while red or orange pills are seen as stimulants. Size and quantity. 2 sugar pills are often more effective than 1. Method. A saline injection is generally a more powerful placebo than a pill. Branding and cost. A placebo presented as an expensive, brand-name drug works better than one presented as a cheap generic. Second, there's classical conditioning. Think of Pavlov's dog's experiment conducted by Ivan Pavlov demonstrating classical conditioning, where dogs were conditioned to salivate at the sound of a bell. You may have learned to associate the act of visiting a doctor or taking medicine with feeling better. Your body becomes conditioned to initiate a healing response based on these cues alone, even if the pill itself is just sugar. But here's where it gets truly amazing. The placebo effect isn't just in your head. It creates real biological changes in your brain and body. When you believe you're receiving a pain reliever, your brain can release its own natural painkillers called endorphins. Brain imaging studies show that a placebo can activate the same pain-relieving regions in the brain as actual opioid medication. It doesn't stop there. In studies with Parkinson's disease patients who lack the neurotransmitter dopamine, placebos have been shown to trigger a release of dopamine in the brain, leading to a temporary improvement in motor symptoms. Your brain, prompted by belief, starts to produce the very chemicals it needs. But this power has an opposite as well, the nocebo effect. From the Latin meaning, I will harm. This is when negative expectations cause negative results. If a person is told a sugar pill might cause nausea, they are more likely to experience it. This demonstrates that our expectations can harm us just as they can heal us. The placebo effect is not about deceiving patients. Instead, it's the gold standard for testing new drugs. In a randomized double-blind clinical trial, one group gets the new drug and another gets a placebo. For a drug to be approved, it has to perform significantly better than the placebo. This helps scientists separate the drug's true effect from the power of expectation. But this also brings up an important question. Is it really okay to give someone a placebo when we already have real, proven treatments? This is something doctors, researchers, and ethicists are still debating today. They're trying to balance the benefits of the placebo effect with the need to be honest and provide the best care possible. The placebo effect reveals a fundamental truth. Our minds and bodies are intricately connected. It shows that context and belief are also part of healing. While it can't shrink a tumor or cure every disease, it's a powerful force that modulates our perception of symptoms like pain, fatigue, and depression. It's about our brain's incredible ability ability to shape our physical reality, just like a hidden pharmacy waiting for the right cue to open its doors. What are your thoughts on the placebo effect? Share them in the comments below.